Story 1. I am not a doctor, but in junior high I had a small cough that would not go away. My grandmother was convinced it was whooping cough. I felt fine. It was just an annoying cough. She made me go to the doctor and told the doctor she thought I had whooping cough. The doctor said it had not been in our area in over 10 years, so she doubted that was the case. My grandmother insisted the doctor test me anyway. I tested positive and was considered patient 0. The whole school ended up getting it, and we had to shut down for 2 weeks until it passed. Story 2. A woman in her 40s came in saying she was having seizures. When I asked how she knew, she said her right hand would periodically stiffen. There was no loss of consciousness or other symptoms typically associated with generalized seizures, but I ordered tests anyway. The tests showed she had multiple focal seizures. Story 3. I am not a doctor, but my aunt and uncle had a border collie that would bury his nose in my uncle's back when he sat on the couch or recliner. He would walk up, sniff the same spot, and keep sniffing until my uncle shooed him away. A bit later he would come back, sniff again, and stare. A few weeks later my aunt was watching local news and they featured a story about a dog that could smell Parkinson's disease. She jokingly told my uncle. He mentioned their dog constantly sniffing one spot on his back, so he saw a high school friend who is a dermatologist. The doctor said it did not look right and performed a biopsy. It was skin cancer, but they caught it early and all my uncle ended up with was a scar on his back. Story 4. This is why I usually ask patients what they think is going on or if there is anything they are specifically worried about. Either I get a clear idea, or I can figure out a way to help them feel better about their concern. Story 5. I am the patient. I told my family general practitioner, whom I had seen since childhood and who had treated both my parents for years, that I thought I had reactive hypoglycemia. He scoffed. You don't have that. Why would you think you have that? I described my symptoms. He was doubtful but told the nurse to get me a can of cola and made me drink it. He sent me to walk around the hospital for a little while, get blood work, and then come back. When I returned, his first words were, "This is so aggravating. Does that mean I have it?" "Yes, that means you have it." Story 6. I am a patient. I had a very painful skin infection on my face and neck that my dermatologist insisted was just an eczema flare. She prescribed topical steroids. They helped in the short term, but I continued to have painful rashes on my face. Edit. I asked if it could be a fungal rash, but the dermatologist said she was sure it was eczema. Unfortunately, steroids weaken your immune system, thin your skin, and can facilitate the spreading of an infection. A few months later, my hands and fingernails became very painful. Daily life was hard because I was in pain when I tried to write, type, or open things. Eventually, I developed bleeding blisters on my hands and my nails turned yellow. I saw the dermatologist because topical antifungals gave me some relief, but I would need oral antifungals to treat the nails. The dermatologist insisted this was dyshidrosis, a form of eczema. I asked for a culture. She took a swab instead of a nail clipping, which is needed to diagnose fungal infections of the nails. The test came back negative. She prescribed steroids again, but I was hesitant to use them because I no longer trusted her. I saw my primary care physician and explained the situation. He agreed to try oral terbinafine and it worked. My nails fell out and grew back and the infection cleared. The rashes on my face cleared as well. I was on the antifungal for 7 months. At my follow-up with the dermatologist, I showed her how the antifungal had worked and that she had been wrong. Story 7. I work as a medical laboratory technician. A patient came in insisting that her neighbor was poisoning her. Everyone dismissed her, assuming she had paranoid psychosis. She remained in the emergency department for a psychiatric evaluation. I ran all the standard laboratory tests and they were normal, but she would not budge. She was admitted to the psychiatric unit on a psychiatric hold. At that point, one of the hospitalists decided to order laboratory tests for several heavy metals and for ethylene glycol. Her ethylene glycol level was 32. I do not know if she was genuinely being poisoned by her neighbor or if it was self-induced, but that patient taught me a very important lesson that day. Story 8. I am a nurse. A patient came in for a colonoscopy because of constipation and painful bowel movements. Before the test, he said he felt something catching on the left side of his abdomen during bowel movements and wondered if he had a large polyp there. During the procedure, we removed a 2.5 centimeter polyp from that exact area. I will never know if the catching sensation resolved, but it was interesting that he was correct. Story 9. One of my dearest friends from middle school suffered devastating medical problems. She went from bright and thriving in university to dropping out before graduation because her health collapsed. She lost her well-paying job and her life fell apart. She told me about a new symptom, a strange anemia caused by abnormally low ferritin in her blood, which prevents red blood cells from carrying iron. That triggered a memory. Severe digestive issues, unusual anemia, chronic splenic infections that required a splenectomy, sunburning to blistering in less than half an hour, a diagnosed allergy to sulfa drugs, severe reactions to carbamazepine, and retinol causing a suppurating skin rash. I had dropped out of a pre-medical program, and one of the first courses I took covered rare conditions and diseases. One inherited disorder we discussed was porphyria. There is an easy way to tell if someone has porphyria. Have them urinate into a clear plastic or glass cup and expose it to direct sunlight over hours. Today's, the urine of people with porphyria will change from clear or yellow to wine red or wine purple. I asked her if she trusted me enough to try something unusual. I told her to get a clear disposable cup, urinate in it, and put it on a windowsill where nobody could see it. If anything changed, she should tell me. Approximately 4 hours later she called, screaming that her urine had turned purple, red like a vampire's, and I told her to go to the doctor and get tested for porphyria. 2 weeks later, she tagged me on Facebook and called me lesbian Dr. House because she was diagnosed with congenital erythropoietic porphyria. For everyone saying I stole this from Scrubs, I did not know Scrubs had a porphyria episode. I looked it up and it aired a full year after this happened. Also, watching Scrubs and suggesting a diagnosis does not cost you $100,000 that you end up paying back for 20 years. Story 10. I knew my partner had leukemia about a week before I could convince him to go to the doctor. He was bleeding and bruising very easily and had petechiae. I wanted to go to urgent care where I knew a complete blood count was done quickly on site, but he wanted to wait to see his primary care doctor. I took him to his primary care doctor and had a bag packed for the hospital in the trunk. The doctor said it was likely a vitamin B12 deficiency but ordered blood work to put my mind at ease anyway. I asked if the complete blood count was done on site, and he said it was sent to an external laboratory. I asked if he planned to rush the complete blood count. He became very angry and said, "There is nothing a complete blood count could show that would change my treatment plan." He then told my partner that he needed to stop me from searching online. That night we received a call from the laboratory that his white blood cell count was dangerously high and his platelet count was dangerously low. I immediately took him to the emergency room, and he was diagnosed with acute leukemia. Story 11. I had a patient who came into the emergency department with vague, mild abdominal pain. Her friend had recently died of colon cancer, and she was convinced she had it too. I explained that cancer is not contagious, but I ordered a computed tomography scan because she was insistent and I wanted to reassure her. To my surprise, she had a large colon mass. A very unusual case. Story 12. I found a lump in my neck and saw the first doctor. She said it was allergies and sent me home with antibiotics. I found a second lump in my neck and saw the second doctor. She said allergies again, told me not to stress, and prescribed different antibiotics. All blood work was fine. The antibiotics did not help. I saw the third doctor. He was more suspicious, but, because I was a 19-year-old, said I was fine and recommended another antibiotic. That night, I looked on an online medical website. A few days later, I saw the fourth doctor. He said he knew it was cancer and to please do more tests. Sure enough, it was cancer. Stage 3 papillary and follicular thyroid cancer. 3 weeks later, I had major neck surgery. They removed my thyroid, 2 parathyroid glands, and 24 cancerous lymph nodes from my neck and chest. I have a 9-inch scar up to my ear. I have been cancer-free for 14 years since October 6th. Story 13. I am an emergency medicine and intensive care unit doctor with over 10 years of experience. While it is not a diagnosis, experience has taught me to take very seriously when a patient says they are about to die, even if they appear stable or controlled. Patients with life-threatening conditions often have a premonition about imminent deterioration, usually preceded by very subtle signs of worsening that can be mistaken for routine events in the resuscitation room or on the back of an ambulance. I have seen patients who appeared completely stable with acute injuries where cardiac arrest was not foreseeable, for example a motorcycle accident with a single limb injury, who briefly mentioned they thought they were about to die and then suddenly went into cardiac arrest due to a malignant arrhythmia. It is believed that patients may perceive a sudden drop in blood pressure and the accompanying release and surge of epinephrine and other catecholamines as imminent death, but the reason this perception occurs is not clear. Some patients can be resuscitated, others are lost, and some survive with severe deficits that some would consider a fate worse than death. Story 14. If you have anxiety, this is not the thread for you. Story 15. A patient came to the emergency department and told me he had epiglottitis, an uncommon infection of the epiglottis, part of the throat. I asked how he knew. He had previously had it and was a 90-year-old retired emergency department doctor. He was right. Story 16. I was a patient and ran cross-country in college. During my senior year, my thigh ached. I told everyone something was wrong with my bone, but I was told it was a muscle issue. After being treated for every muscle problem in the book, I demanded an X-ray. I had a stress fracture more than halfway through my femur. Story 17. I'm not a doctor, but this is what happened when my son self-diagnosed correctly. 3 years ago he developed a terrible earache and went to an urgent care clinic, where they told him he had an ear infection and gave him an antibiotic. The pain intensified over the next day, so he returned and was told to make an appointment with an ear, nose, and throat specialist and otolaryngologist. Because it was the weekend, no offices were open and he had to wait until Monday. His ear began draining and he saw what looked like spores in the fluid. As a naturalist, he recognized them as suggesting a fungal infection. The pain grew so intense that he went to the emergency room. He told the examining doctor that he had seen spores in the drainage and suspected a fungal infection. He later heard the doctor in the hallway laughing and saying that he thought my son had seen spores. The doctor prescribed another antibiotic and a steroid. The next day he flew home to see us for Thanksgiving. As soon as he arrived, he curled up on the floor, howling in pain. I called ear, nose, and throat offices all over town, but most were closed for the holiday or said they could not see him. Finally, one scheduler took pity and moved things around to get him in. A physician assistant examined him and confirmed a fungal infection. She told him that the steroid prescribed in the emergency room is the same agent used in the laboratory to culture fungal infections. His infection had begun to enter the eardrum and could have spread to the brain and killed him. She gave him a prescription that cleared the infection very quickly. The wrong diagnoses at urgent care and the emergency room cost him $1,500 out of pocket and several days of excruciating pain. The ear, nose, and throat office did not take his insurance but charged only $250 for the correct diagnosis. Story 18. When I was pregnant, I was hospitalized overnight because one of my routine laboratory tests was abnormal. I had high blood pressure and extremely elevated liver enzymes, but everything else was normal. I spent the night searching online and asked my nurse if it could be hemolysis, elevated liver enzymes, and low platelet count syndrome, a rare form of preeclampsia that can cause liver hemorrhage and be fatal for both mother and baby if not treated promptly. The only definitive treatment is delivery. She laughed and said there was no way I had it because I would have been in more pain. 2 weeks later, I had an emergency induction of labor because of hemolysis, elevated liver enzymes, and low platelet count syndrome. Thankfully, we are both okay. But I will never get over her flippant attitude about something that could easily have killed us. Story 19. I am not a doctor. I am a patient. I have urinary tract infections that are asymptomatic until I have blood in my urine. I was probably on my 3rd or 4th one at that point, so I went to urgent care. The doctor was convinced I was on my period, and even asked how I knew I was not. I am on seasonal birth control. Luckily, the test showed a urinary tract infection and the doctor prescribed ciprofloxacin. I returned 2 days later because I had heart palpitations, anxiety, and a fast heart rate. I was having a reaction to ciprofloxacin and asked to be put on another antibiotic. The The doctor thought I was crazy but agreed to switch. The symptoms went away the next day. When I finally got a primary care provider, she said it was a definite reaction to ciprofloxacin and, while not an allergic reaction per se, to list it as an allergy so I am not prescribed it again. She was angry that the urgent care doctor had dismissed both the urinary tract infection and the ciprofloxacin reaction. Story 20. I am not a doctor and I do not pretend to be one on television, but I almost became a doctor half a lifetime ago. I diagnosed my husband's brain tumor, which led to emergency surgery. Over a month he was repeatedly in and out of the emergency room for personality changes, extreme sleepiness, a diagnosis of vitamin B12 deficiency, dehydration, frequent vomiting, and vision that looked strange but he could not describe. He was eventually unable to report that his peripheral vision was gone. Ophthalmology noted a swollen optic nerve and suggested it was probably just high blood pressure. After a weekend when I could barely wake him, he returned to the emergency room and waited 4 hours. I asked if anyone had done a computed tomography scan or a magnetic resonance imaging scan of his brain, assuming they had. They had not. I told him to insist on a computed tomography scan because I had a strong suspicion. 2 hours after being called back, he was in an ambulance on the way to a different hospital with a neurological intensive care unit. He was scheduled for emergency brain surgery for a massive tumor causing dangerous obstructive hydrocephalus. Story 21. I am a patient. My story is long. I kept getting migraines more and more often. I started having nosebleeds and blacking out at the gym. One day after the gym, the migraine never stopped, so I went to my doctor, who gave me a Toradol shot. That did not help, so he sent me to the emergency room. At the emergency room, they said it was sinusitis and told me to buy a humidifier, which I did. The migraine did not go away, and I could hear my heartbeat, so I made an appointment with an ear, nose, and throat specialist. They ordered a magnetic resonance imaging scan, and when they saw the results, they told me to see a neurologist as soon as possible. They could not help me see one or write a referral, and I needed one urgently. I called my primary care physician. They sent referrals to every neurologist in my area. I called 13 offices, made 13 appointments, and was put on 13 waiting lists. I saw a neurologist 2 days later and canceled the others. The neurologist said the magnetic resonance imaging showed signs that I might have too much cerebrospinal fluid in my brain, but scans do not show cerebrospinal fluid directly. They can only show side effects, such as thinning of bone from pressure and a flattened pituitary gland. We needed a magnetic resonance venography and a lumbar puncture to see what was happening with the cerebrospinal fluid. We did those tests, and the pressure in my head was 40 when it should be 5 to 15. She put me on medication to lower cerebrospinal fluid production. The pain did not change. She did not know why. Because I had seen any available neurologist, the first one was a sleep specialist. I decided to change to a headache specialist for more focused care. He changed my medications, but the pain remained agonizing. I asked him whether birth control could trigger this and whether I should remove my intrauterine device. He said no and advised leaving it in, saying it stabilized my hormones and would prevent my periods from making things worse. I followed that advice for a few months, then decided to have it removed. The pain dropped significantly within 3 days of removal. I reviewed my magnetic resonance imaging and magnetic resonance venography reports and researched the findings. They showed transverse sinus stenosis. A vein that drains cerebrospinal fluid was collapsed inside my head. I asked my neurologist whether this was important and whether it needed to be fixed. He said to ignore it. I then saw a neuro-ophthalmologist. He said my eyes were fine, so my brain was fine, that what I was feeling was migraine, and that the medications were working. He recommended returning to the neurologist. I sought a different neurologist. I asked for a stent. He saw the stenosis and referred me to a stroke specialist. The stroke specialist said venography is not reliable for showing how bad a stenosis is, and that a neurosurgeon needed to look directly. The neurosurgeon performed an angiogram and saw that the pressure in my head was still 40 after 2 years on the highest dosage of pressure-lowering medication, and I qualified for a stent to fix the vein. I was right. My earlier doctors had been wrong. I had to keep changing doctors and insist that the venous stenosis was the issue until I finally received the correct care. There were more problems over the last 5 years, but that is the major part of the story. Story 22. I was through hiking the Appalachian Trail and was in Southern Virginia near Roanoke. I was having a fine day until I went to urinate in my motel room and saw blood in my urine. I had also been developing spots and sores on my legs only, not above my waist or below my ankles. 3 emergency department doctors said it was a tick-borne illness because I had been hiking in the woods for a month. They suspected Rocky Mountain spotted fever, but I had had that in college and knew it was not that. When the 4th emergency department doctor came in, I told her that, based on my own research, I thought I had Henoch-Schönlein purpura, a rare autoimmune disorder in adults. She agreed and sent me to Virginia Tech for a biopsy, which confirmed vasculitis. I then developed arthritis-like pain in my knees and severe abdominal pain. An ultrasound revealed underlying autosomal dominant polycystic kidney disease, which testing showed I had not inherited from my parents. Doctors began talking to me like I should be in a textbook. 7 years later, I am symptom-free and take a low dose of blood pressure medication, but for a few months it felt like I was on the television show House. Story 23. A cousin from Sweden went on a trip through Africa. His aunt, my mother-in-law, is a doctor in South Africa. She told him to call her if he had any symptoms after he returned home, because she knew that European doctors often struggled to diagnose tropical diseases. He went home, became ill, and called her. She diagnosed bilharzia and told him to repeat the treatment after 2 weeks. The standard single-course schedule had never worked for her patients. He went to Swedish doctors who had never seen bilharzia. They did not really believe him, but because he had recently traveled, they decided to test him. The result was bilharzia. They initially would not repeat the treatment because their textbooks specified a single course of medication, and the infection returned. Eventually, they prescribed 2 courses, as my mother-in-law had recommended. He recovered after that. Story 24. My sister is the weirdest one, I think. A few years ago, when she was in her early 30s, she started having bad headaches out of nowhere. After trying a bunch of over-the-counter medications, taking sinus medication, and changing her mattress and pillow, she called me one day and said, "I think this is a tumor." She did not have any definite red flags at the time, only some yellow flags, but she was sure of it and oddly calm about it, especially since our maternal aunt died of a glioblastoma, an almost universally fatal brain tumor. After a couple more weeks of doctor visits, she finally had magnetic resonance imaging of her brain. Though she did not yet know the actual results, she called me afterward and said it was definitely a tumor because the radiologist added a contrast study after the initial images when they had seen something. A few days later, she saw her neurologist for the official diagnosis of a brain tumor. Thankfully, hers was not the malignant glioblastoma our aunt had, but a completely benign acoustic neuroma. It was large enough to require brain surgery, so it was still a very serious diagnosis, but at least it was not cancer. Story 25. I am not a doctor, but I diagnosed my husband with gallstones when his primary care doctor, urgent care providers, and his mother would not listen to me. The doctors thought he had a stomach bug, and his mother was convinced he had heart problems because of chest pain. I was the only one who noticed his eyes were turning yellow and that the chest pain was not in the typical area for a heart attack. The last time he went to the emergency room, I told him to ask about gallstones. It was gallstones, and they had caused so much damage that he needed his gallbladder removed. The gallbladder was 0.6 inches thick when removed. The surgeon said it was the worst gallbladder he had ever seen and likely kept it to show his students and interns. Story 26. When I was in 2nd grade, I was obsessed with Harriet Tubman. I read every book and watched every YouTube video I could find. Many of those books and videos described in detail what having epilepsy felt like. I wondered if I had epilepsy since I had many of those symptoms, but thought it was too much of a coincidence. Later, after the symptoms became unbearable, I was diagnosed with epilepsy. I still remember a graphic novel that described the seizure aura that precedes a seizure and the postictal state that follows with striking accuracy. Story 27. I am not a doctor. My friend diagnosed herself with the human immunodeficiency virus. She had swelling around her neck, and the doctors were not finding anything. She Googled her symptoms, called me, and said she thought she was positive for the human immunodeficiency virus. I spent the call trying to calm her down and telling her to get tested because I thought it probably was not that. Her doctor also said there was no way, but she insisted on getting tested, and she was right. Story 28. I am a patient. I was right about having a pituitary microadenoma causing Cushing's disease. I asked multiple doctors, including a neurologist, to help with various symptoms, but it was missed for years. Finally, an endocrinologist agreed to test my cortisol levels. They were very high. 18 months after surgery, I have lost 110 pounds. Am no longer diabetic, have normal blood pressure, no longer have kidney stones. I had 8, my hair has regrown, and my glaucoma is resolved. Most doctors just wanted to diagnose obesity instead of seeing it as a symptom of something else. Story 29. I am not a doctor. I am a patient. I contracted infectious mononucleosis at 16, and it never fully resolved. I had recurrences twice a year, with swollen lymph nodes and illness like the initial episode. Blood tests repeatedly showed clear positive markers for infectious mononucleosis. I had my tonsils removed in my 20s, and the condition seemed to subside. 2 years later, the same symptoms returned: swollen lymph nodes and fatigue. I went to urgent care. The physician assistant took one look at the bumps under my arms and prescribed antibiotic cream for ingrown hairs. I told the physician assistant about my history of infectious mononucleosis. He rolled his eyes and insisted they were infected ingrown hairs. I insisted on a blood test and agreed to pay out of pocket. The blood tests confirmed I was positive for infectious mononucleosis, with marker levels 19 times the usual threshold for a positive result. This thread reminded me of that story. I had not thought about it in a while. Story 30. When I was in high school, I had a spell of terrible nausea. I couldn't stop vomiting for hours. My parents took me to the emergency room, where the nurses and doctors thought I had the flu. They tried to send me home, but my mother insisted they do a computed tomography scan to rule out appendicitis. She was right. None of my symptoms matched what they typically see, but my mom just knew. I had emergency surgery a few hours later. Story 31. My sister started acting strangely and passing out when I was 16. In our area, people told my mother that her daughter was on drugs and should be sent to rehab to make the problems go away. The problem is my family knew my sister and we had been raised in a cult, so she would have been terrified of illegal drug use. 7 neurologists and our primary care physician insisted my mother was wrong and that my sister needed rehab. The 8th neurologist saw 5 seconds of video and diagnosed her with epilepsy. Story 32. I am the parent in this situation. My child was sick with very vague symptoms. She is developmentally delayed, so it was extra hard to pin down what she was feeling. I pushed the doctors. They told me it was the flu, stress, or her period. I asked if it could be mononucleosis and was told no, definitely not. A month into it, I called a friend who is a doctor and asked if he would test her for mononucleosis. He agreed to test her, not believing for a second that she had it. She did. He laughed when he called and told me, "Honestly, I would never have tested her for that if you had not asked." Story 33. I am the patient. This happened almost 10 years ago. I was sleeping on my couch on Christmas morning and my dog lay on my knee. I felt a pop and woke up in pain, thought nothing of it, and went back to bed. That night I could not walk on it and could barely bend my knee. I was also a drug addict at the time. I went to the emergency room 2 days later and told them my knee hurt. They did an X-ray and sent me home. 2 days after that, I returned to the emergency room. I could not walk or bend my knee at all. It was swollen and hot to the touch. I told them I was an intravenous drug user and that I thought something was seriously wrong. They removed 300 cubic centimeters of fluid from my knee and sent me home. I vividly remember watching them throw the pus they had just pulled out of my knee into the trash. There were no blood tests. I went home knowing I was going to die. 11 days later, an ambulance brought me back to the same emergency room. I had acute infective endocarditis of the aortic valve, septic shock. My leg was 3 times its normal size. I had Janeway lesions and osseous nodes, and my pupil had already collapsed. They told me I had 1 night to live. I spent 49 days as an inpatient, underwent 3 surgeries, had a wound vacuum dressing and a wound graft. I will reach 10 years clean in January. Story 34. A woman came to maternity triage and said her baby was playing with her bowel. The bowel does not have somatic nerves, so that is not really possible. Long story short, a magnetic resonance imaging study showed she had an advanced abdominal pregnancy. That is, her baby was not in her womb but in her abdomen. On the magnetic resonance imaging images, the baby appeared to be holding a segment of her transverse colon with its hand. It was remarkable. Story 35. I am a patient. I had a work accident. I opened the roll-up door on my delivery truck, and the load of tires fell, hitting my shoulder and neck. A few days later, I began having fainting spells, and my arm became swollen and discolored. I had significant neck and shoulder pain. I saw many doctors, underwent many tests, and visited many specialists without a diagnosis. I determined the cause. I had torn the anterior scalene muscle. As it healed, it compressed the subclavian artery and the nerve that supply my arm. The key to the swollen arm was a quirk of anatomy. The artery was compressed between the points where the carotid artery and the vertebral artery branch off. The carotid artery supplied my brain, but normal flow to the vertebral artery was cut off. My body compensated by reversing blood flow, pulling blood out of the circle of Willis, a ring of blood vessels in the brain. That reversed flow was the only blood supplying my arm for several months. A Doppler ultrasound confirmed thoracic outlet syndrome with a subclavian steal and retrograde blood flow in the vertebral artery. Story 36. I am not a doctor. I am a rural paramedic. Several years ago, a woman called reporting a feeling of impending doom. She had no pain and no other symptoms, just a strong sense that she was about to die. Her vital signs and on-scene examinations were normal, but she insisted on being checked, so we transported her to the hospital. Almost at the hospital, she became very sweaty but had no other symptoms, examination changes, or abnormal vital signs. We dropped her off and gave report, then returned to service. A few hours later, we went back to that hospital and learned she had died. Computed tomography showed a ruptured aortic aneurysm. They did not have time to transfer her and did not have the resources to operate at that facility. The bizarre thing is that ruptured aortic aneurysms usually, in every other case I have encountered, present with additional signs such as a rapid heart rate, low blood pressure, dizziness or lightheadedness, and pain. This woman had none of those symptoms. Story 37. Patient. Doctor, I have a kidney stone. Doctor, there is no blood in your urine. I cannot see anything on the ultrasound. 3 days later. Patient. My stone is causing me pain and cold sweats. Doctor, we should discuss an X-ray of your spine. Doctor, there is a slight misalignment. Could be a trapped nerve. Referred to a spinal surgeon. 2 days later. Patient. I was urinating. What was that? Patient. Doctor, here is the 4mm stone. Story 38. I am not a doctor, but I correctly told my doctor that I had dengue fever. I had just returned from Puerto Rico and had all the symptoms except bleeding. The doctor dismissed my suggestion and said I had the flu. After a few days, he relented and ordered a blood test, which confirmed dengue fever. Story 39. I am not a doctor. I convinced an ex-girlfriend who was sure her pain was just really intense period cramps and a stomachache to go to the hospital when I tried to cuddle her and she screamed in pain. I told the nurse I thought it was her appendix because I had my appendix removed when I was a kid and remembered the intense stomach pain. A few hours after the most unpleasant thanks for your opinion I have ever heard, she was in the emergency room getting her appendix removed. That is how I met her parents. Story 40. I am not a doctor, but my ex had unexplained fainting spells that several doctors over a 3-year span could not diagnose. They were tested for postural orthostatic tachycardia syndrome and many other conditions. What did not make sense at home was that they would pass out at any time, including while sitting or lying down. After searching online, I convinced them to mention narcolepsy to their doctor, expecting the doctor to dismiss the idea. The doctor agreed and arranged a sleep study. The sleep specialist confirmed it was one of the most severe and debilitating cases of narcolepsy with cataplexy they had seen. Story 41. I was halfway through my cancer treatment when I told them it had returned. No one listened except my mother. After 2 months of repeatedly saying something was wrong, they finally did a scan. It turned out my cancer had returned and was approaching a terminal stage. The student doctor learned to listen that day. Story 42. Patient here. I have always known I have something wrong with my heart. I was never taken seriously as a child and a teen by anyone, and the primary care physicians I saw never did anything more than listen to it for a few seconds and tell me I was fine. I learned what I could and could not do in my daily life to keep it from interfering, and over time I put it at the back of my mind. After a series of unrelated medical events over a couple of years, I became aware my heart was getting worse. After much pressure and persistence, I got a referral to a cardiologist who told me to track my vitals on my Apple Watch for a few months and come back with the results, as he was off on leave until then. I was disappointed. It had taken a lot to get the referral, and I was still being brushed off. Then the coronavirus disease 2019 pandemic hit, and everything shut down in my country for 2 years. During that time, the only notable event was being hospitalized for kidney issues after severe gastroenteritis that left me so dehydrated I was hallucinating. Just before discharge, a doctor came around to do final observations. It was a teaching hospital, and he had a group of students with him. He listened to my heart, got excited, and proceeded to use me to teach the students what an S3 heart sound sounds like and how to find it. None of his talk was directed to me, but I listened and I learned. I got the best portable electrocardiogram Holter-type monitor I could afford, and I wore it to take ambulatory electrocardiograms. Then I learned to interpret them, not to a medical standard, but enough to note areas of concern, abnormalities in the waves, my blood pressure and what I was doing at the time, and my physical symptoms. I went back to my cardiologist and told him I had Wolff-Parkinson-White syndrome, that it was getting worse, and that he needed to do something before it killed me. He scoffed, but I had expected that, and handed him pages of relevant electrocardiogram recordings and asked him to at least prove me wrong. He looked over the recordings and my notes, told me he knew medical students who were not capable of this, ordered his own tests targeted on the information I had gathered, and not long after begrudgingly confirmed my diagnosis of Wolff-Parkinson-White syndrome. One catheter ablation later, my life is much improved. The stupidest thing is, if I had been taken seriously at any point earlier, it could have been managed with medication and would not have done permanent, irreversible damage to my heart. I should never have had to learn to read electrocardiograms or spend hours on medical sites reading journals researching heart conditions. I am still convinced I will die of a heart attack, but at least it will not be today and hopefully not tomorrow. Story 43. My husband was bitten by a spider. We live in Australia, so I knew the signs to watch for. He showed none of them, but I was not happy about 2 comments he made. I do not like this funny metallic taste in my mouth, and I do not feel well. I took him to the emergency room despite others saying he would be fine and that I was overreacting and should not burden an already strained system. We arrived, and I told the desk staff that something was wrong and that he had been bitten by a spider. He collapsed immediately. He would not have survived if I had not listened to my gut and taken him, because a 5-minute delay waiting for the ambulance would have been too late. Story 44. My mother knew she had endometriosis. No one believed her because she was young. When doctors finally operated, the disease was widespread and had formed adhesions between her organs. She had several surgeries over the next decade. Thanks to experimental treatments, despite having less than half of her reproductive system remaining, she gave birth to several children. Story 45. I am a patient. I had digestive troubles for a few weeks but thought I was recovering from food poisoning or, at worst, developing something like irritable bowel syndrome or inflammatory bowel disease. One night, while lying in bed with my hands on my stomach, I felt a lump. Nervous. I started pacing around my house and searching online for symptoms. WebMD and various articles kept suggesting cancer, but I kept telling myself it was never cancer. It was cancer. Stage 4B ovarian cancer, to be exact. Whoops. Story 46. I am a patient but work in healthcare. I had pain in my right leg, specifically in my gluteal area. It progressed to lightning like pain down my leg with pins and needles. I assumed I had fluid or a mass compressing my sciatic nerve, and after a week of rapidly increasing pain, I assumed it was an abscess. I started feeling septic. I went to the emergency room. They refused me and sent me up to the primary ward. They immediately sent me back to the emergency room and ordered a computed tomography scan. The scan showed a 500 milliliter abscess under my muscle compressing the nerves in my right leg. Before my second surgery, my specialist refused to believe they had drained that much fluid and I had to show photos as proof. He said, and I quote, "If there had been that much, you would be in the Guinness Book of World Records." He called in other doctors and nurses to review my photos and my case afterward. Story 47. My husband was the patient, not a doctor, but he started having severe stomach pain. Eventually, it became so bad he could not stand up straight. When he got home from work, we went to the emergency room at the Indian Health Service facility. The clinician examined him and said he was constipated. We thought this was strange because he had been having bowel movements, but we accepted the treatment. I was convinced it was the appendix, the gallbladder, or something similar. A few weeks later, it was still bad. He was bloated, seemed to have gained weight, and developed severe night sweats, which were new. He followed the clinician's instructions. In the middle of his shift, he texted me that he was going to the emergency room again because something felt wrong. A little. While later they called to say they were transporting him by ambulance to the hospital in the nearby city because his appendix had ruptured a couple of weeks earlier. It had become the size of a football and he was developing sepsis. We had suspected a serious problem, but were told to take laxatives. It was shocking. Exactly 1 year later, the same thing happened again while he was on a work trip in Fargo. He drove himself to the emergency room, and that time they removed his appendix. Story 48. Me. Hey, doctor. I think my foot is broken. Doctor. It doesn't look broken. Not bruised at all, but we can get an X-ray to check. After the X-ray, the doctor said, "Wow, you broke your fifth metatarsal right in half." My foot wasn't swollen or bruised. I had been running 10 feet from my best friend's back door to my car. There was a dip in the grass, and while I didn't fall, it felt like I rolled the middle of my foot. So yeah, I broke my foot running 10 feet, and it didn't even look like I had. I went to the doctor 3 days later when I still couldn't walk on it. Story 49. No acute distress. Patient here. After enduring chest pain and shortness of breath for 1 week, I went to the emergency department. It took 10 hours to run basic blood work, and I was told to rest for 3 to 5 days. I returned to the hospital 3 times over the next few weeks as it was getting worse. I became bedridden with fatigue. I could no longer lie flat because I developed pleuritic pain while supine. I saw my primary care physician and told him that someone I know said my symptoms matched what they had when hospitalized for pericarditis years ago. I asked if it could be pericarditis. He said no and referred me to pulmonology. 7 months later, after advocating with the referral intake department, I finally saw a cardiologist. He diagnosed me with pericarditis and prescribed colchicine, which was the first treatment I received after 8 months of suffering. More than 3 years since the pain began, and after a few rounds of colchicine plus nonsteroidal anti-inflammatory drugs, I recently had a cardiac magnetic resonance imaging scan. It found past and current inflammation of the pericardium. The newest flare started in early October, and I had been on colchicine plus nonsteroidal anti-inflammatory drugs for a month leading up to the scan, so I am awaiting a rheumatology referral for the next line of treatment. I often wonder whether my case would have become recurrent if I had been properly diagnosed and treated the first time I went to the hospital, rather than experiencing an 8-month delay. Story 50. I am not a doctor. I spent a week in hospital last year with a bleeding duodenal ulcer. I had no pain, but there was blood coming from both ends, which was very unpleasant. After they patched me up and sent me home, I began having lower abdominal pain near my appendix. Because the ulcer and the pain occurred close together in time, I saw multiple doctors saying I thought they were linked. It took nearly 18 months to figure it out. A gastric surgeon removed my appendix and cecum. Testing showed I had a persistent Yersinia infection that damaged my lower abdomen. How did I get it? I had multiple transfusions while in hospital the year before. One of the units of blood was contaminated with Yersinia, a bacterium that can survive refrigeration. I began reacting as soon as they transfused it, so I received only a small amount. Because I was still bleeding into my intestines, the bacterium reached my gut and caused the infection. Story 51. This was not the patient himself but his mother. The child was 18 months old and was admitted for constipation. We treated him with medication and his condition improved, but his mother insisted on a magnetic resonance imaging scan of his brain. We initially refused because we did not think it was necessary and believed it would be a waste of resources. Eventually we gave in, and it turned out he had a large brain tumor called medulloblastoma. Story 52. I am a nurse. I diagnosed myself with epilepsy as a teenager after having simple focal seizures multiple times a week for years. Around age 14, I started having frequent episodes of what felt like déjà vu. I would get hot, my hands would tingle, I felt lightheaded and nauseous. Then I would have the sensation of almost daydreaming, like an involuntary vision inside my head. It lasted around 10 to 30 seconds. I always felt anxious and had a lot of brain fog that day. Sometimes I had migraines and severe fatigue afterward. Whenever I searched my symptoms online, the Epilepsy Foundation would appear, but I brushed that off because I only knew seizures as generalized tonic-clonic seizures with loss of consciousness and shaking. When I became a nurse years later, I learned about other seizure types and began questioning my symptoms. I accepted that my symptoms were most likely a form of focal seizures and that I probably had catamenial epilepsy triggered by my menstrual cycles, since they started when I first got my period. I was hesitant to seek treatment because I never lost consciousness and I did not have obvious triggers, so I felt no one would believe me. I could have a spell while holding a conversation and no one would notice anything other than minor skin flushing. All my symptoms were internal, so it was easy to second-guess myself and wonder if I was just having déjà vu or anxiety. One night, I was working a shift at the hospital and felt a seizure coming on while in a patient's room. It felt much stronger than usual, so I sat down and instead fell to the floor unconscious and had a generalized tonic-clonic seizure in the room. I woke up confused, unable to speak properly, with a bloody, bruised tongue and my shoes in two different corners of the room. I was taken to the emergency department, and after testing and a neurology consultation, I was formally diagnosed with catamenial epilepsy with simple focal temporal lobe seizures. I am now controlled with medication and seizure-free. I am ashamed at how long I went without treatment because I feared being wrong about my self-diagnosis or not being believed. Thanks a bunch for sticking around till the end of the video. Remember to subscribe, and until next time, stay awesome and goodbye.